Okay, so the health equity assessment tool. Now, if have seen the video about co-production, you've probably got a good idea now in terms of what the preparation is around this before you even consider doing the health equity assessment. If you haven't, there's a link to it below in the description, so I do advise you have a look at that first. If you have, then let's just do a quick recap. So what we learned from co-production is that actually what it does, if done well, is it helps to frame the problem at heart that you think needs to be solved. It helps that you've not gone into that with any preconceived ideas. You've not gone in there being overly solution focused. It helps if you followed all of the principles. It helps you frame what that is. And let's just do the recap again on what those key kind of questions are in that co-production group. So remembering in co-production, we were using those coaching style questions from the GROW model, when we were literally just changing the you to a we. So what we were asking our co-production group is we were asking them questions around the present situation. What do we need to talk about? What's the problem we have? And then we were talking about the desired situation. What would we like to have happen? Is there anything else about that? And then finally, what actions the group felt we could take. So what needs to happen? What could we do about this? What could we do that we haven't tried? What else could we do? What does good look like? What are we going to do? And when will we do that by? So those are the kind of conversations you'd have in your co-production group. Now, I get asked quite a lot, and when do I need to do a health equity assessment? And if we just think about that co-production kind of those co-production conversations, then actually really the times to do the health equity assessment, the times to have those kinds of conversations are when we have problems in front of us. And those normally are things around when we're expecting to solve a new problem by redesigning something, designing something new, setting some values and principles around how we're going to approach something, i.e. a policy. It tends to be anything where something's going to happen which is going to impact three things. It's going to impact people's access, experience and outcomes of care. And there's probably not many cases where that wouldn't be the case as commissioners. So it's where ultimately what we're going to do is going to impact on access, experience and outcomes of care. The other way to look at it as well is that health inequalities exist everywhere. If we can't see them, it's probably because we haven't looked hard enough. And by following those co-production methods, it's a way, if you remember, it's a way of actually helping to achieve health equity. So recap on what we mean by health equity as well before we actually look at the first section. Health equity is fundamentally about giving people the resource they need to realise the outcomes that matter to them. You're giving people the resource they need to realise the outcomes that matter to them. Health inequalities is different. It's about giving everyone equality is different. It's about giving everyone the same amount of resource, which might be fair, but it might inadvertently create inequalities as well. So equity is about giving people the resource they need to realise outcomes that matter to them. Still in a targeted way, obviously. So we've just done a quick recap in terms of what co-production is, and how you'd have kind of conversations to help frame the problem. The reason why that's so important is for the health equity assessment, most of the work is in the preparation itself. The actual health equity assessment itself should be relatively straightforward. It will be more straightforward if you follow those principles around co-production and those conversations first. That I can promise you. One of the reasons why, in my humble opinion, I think we in the NHS and we as commissioners may be going through that cycle of having the same problems being put in front of us, the same issues. It's not just centered around resource, believe it or not. I think in many times it's centered around the fact that we may not have framed the problem right in the first place. And so that co-production framework and those conversations and the methods, the coaching methods we've gone through already are designed to try and move on from that. And they're designed to try and get us to really pinpoint actually what problem are we actually trying to address in the first place. Before we run off and just think of solutions, what are we trying to do? What's the improvement that needs to be made? Where are the inequalities? Who's enduring those inequalities? Who's experiencing them? How, in what way? What does that actually look and feel like? And this essentially is what the first section of the Health Equity Assessment is all about. It's about your program of work. What is it you are actually going to do? What's the actual aims of the work that you're going to do? How is it going to go about actually reducing inequalities, and what actual way is it going to do that? And when we talk about inequalities, what specific inequalities are we actually on about? So yeah, the first section sets out what's the aims of our work, where are the inequalities, and how do we expect what we want to do to solve this problem? How are we expecting it to actually have an impact and reduce those inequalities in the first place? But yeah, that's why those co-production conversations are really important. Let's go back to what those co-production conversations were about, shall we? Because that we can see straight off the bat how that's going to help about. So the coaching style conversations in that co-production environment, we're asking things like, what do we need to talk about? What's the problem that we have? What would we like to have happen? Is there anything else about that? So describing the present situation, what do we need to talk about, is clearly going to lend itself to being able to actually explicitly display what the actual problem is we're trying to address. The desired situation, what would we like to have happen? So already you're starting to try and frame what would we like to have happen. So in that sense, what we would like to have happen in terms of what would we like to do to actually reduce the inequalities we've actually found in the first place. And is there anything else about that? And then the action, what needs to happen, etc., etc. So let's just think of an example off the top of my head right now. Let's just think of it happen. If we pick something really that a lot of people will know about, a lot of people resonate, that affected people quite a lot. Let's go with the COVID vaccination program. So what's the present situation? Well, actually, let's pretend, let's go back 2 years. What's the present situation? So the present situation, what do we need to talk about is that parts of our population were really hesitant about wanting to have the COVID vaccination. And there are still parts of our population now who continue to be hesitant about having vaccinations generally. What's the problem that we actually have? The problem that we actually have is that there are parts of our community that have a level of mistrust towards public authority, have been historically marginalised in many other settings. There are parts of our community who feel that they are not heard. There are parts of our community who are frankly more concerned with looking at their health and well-being purely in terms of the basics, in terms of putting food on the table, putting petrol in their car, getting to work on time, and other things around their wider health and preventative things and keeping themselves safe. They're not prioritized because they don't think it's important. They're not prioritized because they're more important about literally the real basics. So straight away there, we're talking about setting out what the present situation is. Nice and simple, no complicated. That's the kind of setting out the present situation. And then we talked about the desired situation. So what would we like to have happen? So in light of what you've just said, what would the group, what do they think should happen? And is there anything else about that they want to talk about as well? So that's about the desired situation. And then what needs to happen. So what needs to happen is the action that you're going to take against the inequalities that you've just been speaking about. So what needs to happen about that? So, okay, we need to figure out ways of being able to communicate more effectively with people who feel that they're marginalised. We need to identify people who are peers, who people are figures of public trust. We need to move away from just relying upon figures of public authority who think they know best, but actually they might not. They might cause more problems, and we need to invest time, effort, and energy in finding people in our community who we normally might not have considered approaching, and gifting with some resource to be able to have conversations with people in the community, to find out what might be done to be able to build their faith and trust in healthcare systems, that are looking to give them a vaccination or give them a health check, but actually how they go about doing that might be slightly differently to take account of ongoing needs around trust. So we start to talk about the action that needs to be taken. What can we do about this? What can we do that we haven't tried? What else can we do? So there we go. This is section 1. This is setting out those things around, talking about what's going on right now, what we'd like to have happen, and what needs to happen. But it has to be centered around inequalities. Now, in the next section, we're going to be talking about the data and the evidence around that. So in the next section, we'll be talking about what data supports your ideas, building on the fact that you've just framed the problem. And yeah, good luck. See you soon. Cheers. Bye.